Hi, everyone. Hello, hello. All right, welcome. Well, we will begin in a second or so. While everyone is coming in, please share your profession or student or other and where you're tuning in from in the chat. We are very thrilled to have you join us. My name is Gaia, the post-secondary student liaison at Health Promotion Ontario's Executive Committee and the moderator for today's session. Today, we're very excited to kick off our webinar, A Day in the Life of a Health Promoter. We'd like to start today's webinar by acknowledging the traditional lands on which we are situated. Today, I'm meeting virtually with you from what we now call the Greater Toronto Area. I acknowledge that this is the traditional land of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. With this, I respect the long-standing relationships that Indigenous peoples have to this land, as they are the original caretakers. I acknowledge historical and ongoing injustices that Indigenous peoples endure in Canada. I encourage you to take time to reflect on the traditional land on which you are situated and how you can play a role in renewing respectful relationships with Indigenous communities. Now, first, a few housekeeping items. Please note that the presentation is being recorded. It will be available and distributed in the upcoming weeks for your convenience. We also encourage you to share your questions in the Zoom Q&A section and participate in the discussions using the chat box during the presentation. Okay, let's get to it. To kick it off, I would like to introduce you all to Kitten, the Active Advocacy Coordinator of the HPO Executive Committee, who will share some opening remarks on health promotion as a field itself.
Hey everyone, thanks Gaia. My name is Keithan Shankardas. I'm an associate professor at Wilfrid Laurier University, and I'm just going to start things off, like Gaia said, by kind of situating you in terms of what is health promotion. Some of you might be working in the field already. Some of you might be students exploring your interest in this area. So, what the way I usually break it down is if you think about public health, as this companion to our healthcare system, right? Our healthcare system is reactive. It's trying to help people when they get sick. Our public health system is trying to keep people healthy. And we do that in two main ways: health protection and health promotion. And health protection is when we kind of know that there are these harmful things out there. And so we structure our society in a way to protect us from them. So if you have for example, restaurant inspections, maybe you could think about as health protection. We know that foodborne illnesses can lead to epidemics. And so some cities have systems of inspecting restaurants and giving them a grade. Whereas health promotion is all about enabling people to be as healthy and well as they can. And that involves a really multidisciplinary approach of thinking from the level of the person all the way up to society. So one way to think about what is health promotion compared to health protection and the curative system is to think about the difference between the biomedical model, the behavioral model, and the socio-environmental model. So the biomedical model is really what our curative, our healthcare system works in. That health is the absence of disease. And so when someone gets ill, we have to get rid of that illness. And that's the biomedical approach to health. And that's great because, when we get sick, we do want to get better. But we know that there are ways to keep ourselves healthy. And the behavioral model thinks about that a lot. What's the right dietary practices? Should you drink? Should you smoke? How much of those things? Thinking about our health behaviors, which are within our control, as a way to think about our well-being. Health promotion certainly acknowledges the importance of those models, but it really also seeks to encompass a socio-environmental model where health is the product of social, economic, and environmental circumstances, so that we can also think about the policies that local or higher level governments make. We can think about the communities we live in and the other people and places in those communities and how all of those things, the private sector, how they all affect our well-being. So another thing to really understand about health promotion is the Ottawa Charter for Health Promotion. If you haven't heard about the Ottawa Charter, it was created in 1986, and it really is a foundational document for this whole field of health promotion. The Ottawa Charter was created through an international meeting, which was hosted in Canada, in Ottawa, And it really laid out some of the core functions for health promoters, which is to be an advocate for these kind of social and environmental factors that need to be addressed for greater well-being and equity, enabling people to be as healthy and well as they can. So we have health promoters going into kindergarten classrooms and teaching kids how to brush teeth, because we know, there's no kind of free dental care yet, and we need to take care of these teeth if we want to have a lifelong relationship with our teeth. And mediating, that's the other health promotion core function is, when we start to realize that it's the social determinants of health that really affect us, we need to start talking to people outside of the healthcare system to really make sure that our societies are being structured for wellness. And the last thing I'll leave you with the Ottawa Charter is that there are action areas that we can define through the Ottawa Charter for health promotion. Not just things like developing personal skills, but creating supportive environments for those personal skills. So it's the difference between knowing, how to brush your teeth and living in a community where you can afford to eat nutritious food so that your teeth don't break down as quickly. Reorienting health services. So like thinking about how the healthcare system cannot be strictly focused on curative services, but can also do a bit of the prevention that health promoters are really interested in. Healthy public policy is another key health promotion action area from the Ottawa Charter. Of course, the policies of governments dictate what a lot of our social and environmental circumstances look like. And finally, maybe I think the most important one is strengthening community action, because health promotion is really about enabling people and communities to be well. And a lot of that is reliant, or at least would be really benefited through communities that are active and interested and able to advocate for their own well-being and to take care of each other. So those are kind of, a broad theory, the Ottawa Charter. It's kind of abstract. And so what I'm really excited about is today we're now going to shift to hearing from people actually working in health promotion professions. So it should give you an opportunity to not just think about health promotion as this kind of ideal, but to actually understand what it looks like in practice a little bit more. And so Guy, I'm going to hand things back to you.
Thank you very much. Thank you so much. That was eloquently done. So now that health promotion is fresh in our minds, I would like to introduce you to our first speaker, Chris Sherman, a public health educator at Chatham Kent Public Health for 18 years, focusing on physical activity promotion, with 3 years of experience as program manager for the chronic disease and well-being team and executive roles in the Ontario Society of Physical Activity Promoters in Public Health. Chris holds degrees in human kinetics and education from the University of Windsor. Please note that unfortunately, Chris will be unable to stay for the Q&A due to an emergency. We'll have lovely Leah, who specializes in mental health promotion and gender-based violence prevention, public policy, joining us from a Kingston Public Health unit. We encourage you to share any questions you have on this side of health promotion in the Q&A. All right, Chris, the floor is yours.
All right. Well, thanks, Gaia, and welcome to everyone that's on the call today. And thanks, big thanks to the Health Promotion Ontario team for the invite to come and speak to you. So yeah, like was mentioned, my name is Chris Sherman. I'm a public health educator with the Chatham Kent Public Health Unit, currently on the school and community health team here. And and I guess it was a great introduction there, shared in terms of kind of the overview of a lot of the foundational pieces in public health, health promotion, the Ottawa Charter. Obviously, in public health, we are really guided by the requirements under the public health standards, primarily under chronic disease and well-being, substance use and injury prevention, healthy growth and development in our school health standards. So it's not to say that health promotion doesn't occur in other programs or other aspects, but we are really, we have a mandate requirement, specific language under each of those for comprehensive health promotion. So what does that look like here at our health unit? We currently have health promotion allocated across, or health promoters, staff allocated across teams in an effort to kind of expand our health promotion capacity and competencies across all programs. So we have 5 public health educators in a number of different programs. We have 1 youth engagement coordinator, 2 public health nutritionists, and 1 public health dietitian. And our substance use prevention and injury prevention portfolios are currently with public health nurses. In being from a public health unit, our priority really is that upstream prevention. The primordial and the primary prevention pieces where we're addressing underlying circumstances or those risk or protective factors to delay or reduce the incidence of disease. This has been a challenge, as you can imagine, especially in the last few years. It's becoming more of a challenge because we do tend to get sucked into that secondary prevention, tertiary prevention area because of such of the many of the urgent needs that are pressing in our community. But our priority remains from a public health perspective in that upstream primary prevention space. So. That's where I'm going to come at. A lot of the information I'll share with you today is from the upstream side of things. So within my current role, and this wouldn't be day to day per se, but kind of the different aspects that I would of my work that I would work on at any given point. In terms of education awareness, I do specialize or work in a focus area on physical activity promotion. So a lot of my work centers around education awareness, so communications and resource development, community presentations, relationships and collaboration. So I do sit on numerous community tables or boards with community partners and different municipal departments. We're lucky here, very fortunate here in Chatham-Kent that we have a single tier municipality. So it's very easy, I guess, from that sense that we're only dealing with one municipality, and so I've been able to make connections. I have a strong relationship from folks in many of the departments. Other health units aren't necessarily as fortunate, where they may have upwards of 10 or 12 municipalities that fall within the region. So you can imagine building those relationships and working with the different municipalities with different needs and at different just having different needs overall that you're trying to support. So the other piece in terms of relationships is more that um, internal kind of within the practice, within the field, just connecting with colleagues across the region and across Ontario through our Southwest Physical Activity Promoters Network and the Ontario Society of Physical Activity Promoters in Public Health. So both of these networks allow the opportunity to kind of stay informed and with others who are doing similar work in other communities across the province. And we have done several collaborative projects regionally and even provincially over the past, I'd say, past decade. So really leveraging a lot of that support from other colleagues. And I always talk about how we're on a team at our health unit here, but really those the other folks that are doing the same work you are that are in other health units or other regions, we really look at ourselves as a team as well, because our day to day is so very similar in most cases. So we can really lean on each other for that knowledge and experience. Capacity building, coordinating workshops and skill building opportunities. I wouldn't say that I deliver as much now, can from time to time, but more so facilitating and coordinating some of those workshops or skill building opportunities. So working with community partners to kind of arrange and facilitate bringing speakers in or depending on their needs, right? Do quite a bit of that work. And then healthy public policy and kind of the advocacy aspect. Um, I do sit on or have sat on, and again, this ebbs and flows depending on the timing, depending on what, politically may be a hot topic or what have you. But I do sit on different committees, whether it's a Parks and Recreation Master Plan review, which I've sat on in the past, and we're currently undergoing one again. Trails Council, an Active Communities Committee, Active Transportation Committee, tables of that nature. And it's more so as a staff support kind of liaison role where I would be able to bring information back and provide feedback on different topics. So that's kind of our route that we're able to utilize best to inform some of our local policies and even master plan strategies, what have you. In terms of reports, presentations to Board of Health as well, those are some major avenues that we've utilized in the past, or I've been able to work on in the past, and even as recently as in January, taking there's been several instances. One example that I've highlighted there is the physical literacy alpha resolution in 2015. So that was a resolution that we leveraged kind of in our work with through the Ontario Society of Physical Activity Promoters, brought physical literacy recommendations and key messages forward to the board, and the board actually sponsored an alpha resolution which was passed. And the only reason I like to highlight that is, to my knowledge, that is one of the, or if not the only, physical activity promotion related resolution that they currently have. So that was exciting, but definitely not something I would work on day to day, but it does come up from time to time. So in terms of a current or more recent project that I wanted to highlight, because we've really looked at it here as a great example of a health promotion initiative, and one of those a great example as well as those upstream approach to chronic disease prevention and just to overall healthy growth and development in our community, and that's a physical literacy Chatham Kent community project. So this was a multi-sector collaborative project from that began in 2019. We are just one, as a public health unit, we are just one of many partners that I've listed there. And our role, or my role, was kind of providing in-kind support to the coordination of the project activities. And it was funded primarily through a Trillium Foundation a GROW grant. The YMCA of Southwestern Ontario was the lead applicant. And then you can see several of the partners there. Our school boards were involved. We had several departments from within our municipality, including childcare and recreation. And then Sport for Life was uh, really the key behind the training from a physical literacy perspective, and the assessment and evaluation, as they have supported these grants. And at the time, it was 7 communities across Canada were doing similar grants. The target population, or sorry, similar projects. The target population was community program leaders in recreation, childcare, education, health, and sport who work with children 0 to 12. The objectives were really to build a community where people understand, value, and develop physical literacy and participate in quality physical activities that supports their well-being, and a community where parents, teachers, coaches, and practitioners are informed, trained, and supported in delivering physical literacy. And our overall goal was to train 800 community leaders over, which was originally a 3-year project. It got extended a bit due to the pandemic, the delays caused by the pandemic response, as you can imagine. But the overall goal was to train 800, and happy to share that we surpassed that, and we trained 1,000. I think it was 1,088 was our final total. So, despite the challenges that the pandemic brought us, pretty much right in the middle of that project. So that was exciting. But I just want to take a step back and kind of, I think it's important to explain what physical literacy is, because I think the approach, even with physical literacy, was different than what we've taken previously around physical activity promotion in public health. And physical literacy is really the definition is the motivation, confidence, physical competence, knowledge, and understanding to value and take responsibility for engagement and physical activities for life. Um, so it's really wrapping in. Here's a nice illustration of the physical literacy cycle, the concept in a general sense, where it really begins with movement competence. So fundamental movement skills, kind of as those building blocks for an active lifestyle. And the idea that, in the concept that as children develop competence in movement, they gain confidence, and then they find value, or they find motivation and enjoyment through movement, which then leads to increased participation, which then just leads to further refining and developing more competence, and the cycle continues. There are there are different components to physical literacy. So it's more than just the behavioral piece, but it's also that physical piece with the skills and the psychological aspects around confidence, motivation, enjoyment, and even decision making, connectedness, and relatedness that they find through participation in their settings. So I just wanted to throw up the difference because although the terms physical literacy, physical activity, and physical fitness are often used almost interchangeably, they're not, and they can be related. They're not the same. Physical literacy really is that um, foundational kind of preparing. Preparing children or preparing any individuals with those physical skills, the psychological skills, and the knowledge and attitudes to be able to lead an active lifestyle. Where the physical activity, historically, we've focused on physical activity, the behavioral aspect, and that would be more around, are they getting enough steps every day? Are they how much time are they spending in moderate to vigorous physical activity? So I just wanted to highlight that because I think it really helps put it in perspective a bit in terms of taking it one layer deeper than just kind of advertising the Canadian physical activity guidelines and trying to promote those to folks to increase their activity levels. So physical literacy, I should mention, even just the concept of physical literacy really relates well, and there's several different theories and models that relate well to this. But physical literacy in itself really relates well to a self-determination theory, and that's really a theory of motivation where kind of the related interrelation of, or sorry, the how the need for autonomy, competence, and relatedness is impacts intrinsic motivation, and that's more of a psychological based theory. But that links more to the physical literacy approach. Per se, what we did with our project here again was on a broader level, was related to the social ecological model, and many of you are familiar with this, looking at how, from a broader context, the individual is influenced and impacted by those relationships, mentors, family members, coaches, teachers, what have you, and then the greater community at large, and obviously the societal impact at a higher level through policies. But our predominantly we focused on that relationship and the community level, and trying to really wrap around providing by building capacity in the community, and really um, building the skills of our practitioners that are working with children and youth in these settings. We're able to create a supportive environment that provides positive quality physical literacy experiences for children, regardless of what setting that they're in. So as I mentioned, quality physical literacy experiences, what does that really entail? And it really falls back to it comes back to people, programs, and places. So having knowledgeable, trained leaders, caring leaders, instructors, coaches, parents, caregivers, quality people delivering quality programs that are developmentally appropriate, progressive, and challenging in places that are safe, inclusive, fun, fair, and accessible. And I highlighted accessible because that was really where one of the key pieces that when we first got together in exploring this project was that recognizing that a lot of children's experiences in the community are often dependent on their socioeconomic status, or their proximity maybe to recreational facilities, or to outdoor playgrounds, or green spaces and that sort of thing. And where we really thought this capacity building initiative could help is that it really helps in every setting. So I think here are approximately 96% of our children and youth attend our publicly funded school system. It's already there. Everyone's, for the most part, between the school system and the childcare system, we're reaching the vast majority of children in those settings, and really trying to help bring some equity in terms of I don't want to use the term maybe play equity, but it's really providing opportunities so all children have that the opportunity to learn those fundamental movement skills and develop physical literacy. And it's not just those that are, maybe their parents can afford to put them in specialty camps, or that they can do extracurricular, activities outside of the school. And in many cases, especially with folks living in the urban centers that don't have access to outdoor spaces as much, green spaces, parks, playgrounds. This was a great way to get them active and teach them some skills. So that's really where we came at, at it from that angle, and trying to make it more inclusive and more equitable, by delivering quality experiences to all children in those settings. Um, and again, this is the, if anything I could highlight is probably be this in terms of the perspective. So changing the perspective from, I know when I started in public health, and we still do this, it's still very important, but I know that when I started, we were very much running a lot of programs on, promoting the physical activity guidelines. We would do lots of walking programs through the libraries or through workplaces, just, trying to promote people to get more active. And the focus was on the behavior. And when we look at it from a physical activity standpoint, we're really looking at, the number of steps, the time spent in moderate to vigorous physical activity, or the type of activity. When we change that, now looking at a physical literacy perspective, we're now looking at the variety of movements. Are children learning and improving their skills? Are they developing confidence in their abilities, a connection with nature, a connection with others, and friends in the community? Is it fostering a sense of enjoyment? So it really was a big change for us, but I think it also holds more value, because there's a lot of other elements now that we can attempt to measure and be able to judge whether those experiences were valuable. So activities that we had within the project really focused around capacity building, education awareness, cross-sector collaboration, and evaluation. I won't go into all of them on the screen, but I will mention the capacity building was the predominant focus. Probably, I would say 80% of our energy and efforts was spent in the capacity building piece. And it was really where we had an embedded mentorship model, both within schools and within childcare. And then we did some additional training within recreation, separate from that. But the embedded mentorship model really brought a mentor into the schools, into the childcare facilities, and they worked with staff in their settings, kind of alongside of them. And it may vary. We left it up to each center, each school, on what would work best for them. But essentially, it was the approach that instead of bringing them to, workshops outside of the school hours or the school day, um, and trying to then take their lessons learned and back and apply them, the mentors actually worked with them. So it really helped with engagement. It really helped them see kind of that hands-on practical experience in the classroom or in the childcare setting. And the mentor worked with them over, in general, it did fluctuate, but in general, they worked with them over a period of 1 to 2 days for up to 7 weeks in the schools. And then in the childcare settings, we had one mentor that worked in each childcare facility for up to 1 month, working with the ECs in that center. So, relating this to the health promotion competencies, and I've listed several there. I think it really ties in. I find myself, and not just with this project, but much of the work that I've done previously, it ties in with just about everything. But I wanted to highlight a couple. One was the community mobilization and building community capacity. That has been, I would say, a large portion of my work throughout, even outside of this project. Um, I don't want to, I guess I can't underestimate it, because it is very, very valuable, building relationships, and how, I guess, everything that we're able to, and I'll show a slide in a moment that kind of encompasses this, or illustrates it. But everything that we're able to accomplish was built over a great deal of time, and it took a long time for us to mobilize the community, but it was a very slow, um, but positive process. And I've really found that you know, a lot of times we come with a lot of great ideas. We come with a lot of you know, new theories, new concepts, new potential solutions. But there isn't necessarily a state of community readiness, and it's difficult to mobilize the community. So I'll show, like I said, I'll show a slide in a moment here on how what it kind of took to get to this point. But I don't want to underestimate that at all. It's critically important to I find anyway, to any of the projects that we and interventions that we take on. The communication piece, wanted to highlight that as well. In terms of specifically in my most recent work, communication has been critical. Being able to stay in you know, constant contact with our community partners, being able to relay whether it's deadlines, or you know, funding deadlines, or whether it's in terms of this project, or in terms of you know, just planning, overall planning. It was absolutely essential, and something that I find myself doing more so, even more now in this virtual age. A lot of virtual meetings, a lot of email, a lot of communication, and I would say that that took up a bulk of my time. Aside from the planning aspect, um, most of it was taken up with communication, and it was very shouldn't say it's not always positive, as you can imagine, dealing with community partners who may or may not be maybe at a state of readiness, or willing to kind of jump on board with what you're you know, proposing. It was very critical to kind of maintain a positive, open channel of communication, because some folks I found that didn't initially want to maybe participate, they came along later as they began to see progress in other areas or other sectors. So it was just being able to communicate back to them, especially um, our successes, was what was great as well. Partnership and collaboration, I've kind of touched on that a bit. Plan and evaluate health promotion action. It was a large component. However, we were able to leverage a lot of the skills and assets from Sport for Life when we went through this project specifically. And we did have a final report that we took into. We did surveys with all of the folks that took part in the mentorship program, and then we did actually bring in the infant child, or folks from Brock University and the infant child um, health lab, sorry, to do some of the physical literacy assessments with children. So that was a really unique experience, and it wasn't required. It wasn't a requirement of the grant, but it really, I would say, was some added some value to the findings when they could see the you know, the outcomes with the youth. So so
Thank
that
you.
was a big component. Sorry. Yeah.
Oh, no, it's okay. Thank you so much for sharing all of this. I do like to be a bit mindful of the time. I encourage you to share the practical advice in the chat.
Okay.
This was wonderful, and it looks like the chat is booming, and they're sharing their thoughts about your project. So this is wonderful. Thank you so much, and I do believe you have to jump off, so I definitely don't want to hold you off for much longer. Um, uh, Thank you. Thank you so much. I encourage you to share the advice in the chat. So now we have Autumn Getty as our next speaker, and a two-spirit and LGBTQIA plus client advocate at Compass Community Health. She also serves on Hamilton's LGBTQ group and is an active chair at Women and Gender Equity Advisory Committee. Autumn was instrumental in the development and acceptance of the City of Hamilton's Transgender Protocol. She's also an accomplished poet with 2 books, Reconciliation and Repose, with an award-winning first book having international acclaim. Autumn, over to you.
Thanks very much. So could I just get the slides up, please? You have a chance? Thanks. I'm just gonna adjust my screen here so I can see. Yeah, so I'm Autumn Getty. I'm the community development worker for Two-Spirit and LGBTQIA plus folks at Compass Community Health. Next slide, please. Our motto at Compass is no obstacles to health. So I just wanted to share that as an introduction. Next slide, please. So we use a community health center model of care at Compass Community Health, which involves 5 different areas of service generally. Those are primary care, illness prevention, health promotion, community capacity building, and integration of care. Mostly, I deal with a lot of those things, but mostly with could you just go back to that slide for a second, please? Mostly with the health promotion, community capacity building, and integration of care. Okay, next slide, please. So the way we divide things up in our health promotion at Compass Community Health is we have a health promotion specialist who kind of holds us all together, and then we have several different positions within Compass. So I'll just share a few of those with you briefly. Go back, please. Thanks. So we have we have someone who represents Cooking with Compass, which is a program that which is a series of programs actually, which generally deals with children, but also with some adults. So we have a before school breakfast program, and then we have an actual Cooking with Compass program where we teach young people to cook and to have better relationships with food than they might encounter otherwise. Um, and then we also have a food security specialist, and that person um, largely tries to create solutions for folks who don't have a lot of access to food in the community. One of our one of the programs that we're most proud of there is our food prescription program. So people can sign up to be part of that program, and then they can every 2 weeks they come in. They give us $10 and they get about $40 to $50 worth of groceries. So basically, what we do there is people who are most in need, we actually have our providers write a prescription for them, and then the person brings the prescription, and that's the basis under which they can access the program. Recently, we've added a social prescribing system navigator. So this person works mostly with newcomers and with people of color. And they're doing something similar to what I just mentioned with the prescription program for food, but the prescriptions are more for a wider variety of needs. Next slide, please. Okay, sorry, just reading the comment that popped up there. Yes, I can share more information about that later. So as far as my personal roles and activities, my focus is on the health and well-being of Two-Spirit and LGBTQIA plus folks. And we do that under a social determinants of health philosophy, which I believe we heard about earlier in the presentation. And this has been really important for us to determine sort of non-physical problems that people have that relate to developing poor health, specifically poor mental health. So we focus a lot on things like education levels and social isolation and access to employment, access to healthcare, and we tend to look at those along the lines of like in different communities. So in the Two-Spirit and LGBTQIA plus community, there are severe deficits in those areas. So generally, statistically, for example, in education, the more educated someone is, the more they might have access to better wages, better healthcare, and things like that. but we find that with Two-Spirit LGBTQIA plus folks, that's not the case. So specifically, transgender people tend to be more educated than cisgender people as a whole, and yet tend to have less access to resources. So a big part of my job then is developing networks and a knowledge of resources that I can share with my clients. Next slide, please. So my daily practice involves three major areas. So I do a lot of one-on-one work with clients where I might focus mainly on things like goal setting or listening to problems that they might be having. So with the goal setting, I sometimes will do employment activities with people. So I might look over their resumes. I might refer them to different employment agencies in the city. Um, so there's that. And then also I try to get people access with healthcare. Sometimes at Compass, if we can squeeze people in, but often more broadly around the cities and communities. The second role that I have is to deliver groups or different programs. So I run an LGBTQIA plus intergenerational kitchen where folks can come and prepare. We all prepare food together, and then after we prepared the food, we sit and eat together. And during that, there's a lot of conversation that occurs between the different people who are attending. So the focus on that kitchen isn't so much on physical health, but more on social health. Often we do create meals which are perhaps less nutritious, but they're meals that clients may only rarely get a chance to have, and so they request that we make them, and then we go ahead and do that. I also run a trans femme peer support group, several different social groups. So we have like a gaming group where people play tabletop role-playing games, which have been shown to be great for trans folks who are developing identities or struggling with their identity. We have a gender gear program where we provide free gender gear to different people in the community. And then we also deliver programs in partnership with many other organizations. Um, The third part of my job is to work with partners to create better systems for inclusion for Two-Spirit and LGBTQIA plus folks at different organizations. So for one example of that, our food bank program that we developed came out of consultation with a local food bank where we decided that there was a need to have like a special isolated time just for trans folks to access both menstrual products and food. Next slide, please. So, 1 second. So we developed the Queer and Trans BIPOC Community Engagement Program, which was an attempt to address the lack of Black, Indigenous, and people of color engagement in our other program for trans and queer folks. We found that we weren't getting much attendance from those folks, and so we wanted to create this program. It continued a previous pattern of engagement with people of color with several different organizations. And so the organizations we had worked with previously were Spectrum, which is at the YWCA, the Hamilton Trans Health Coalition, and the BRAR Trauma and Mental Health Services. And with those folks, we developed a toolkit for providers working with queer and trans BIPOC folks. Next slide. Um, so our plan for this group was to develop a weekly event for queer and trans BIPOC youth and also focus away from models which seem too clinical to clients. We had often gotten comments that at some of our peer support groups, people felt like they were at something like an AA meeting, and we wanted to get away from that. What we did do is hire two queer and trans BIPOC engagement facilitators, And we feel like this was part of developing community, and similar to what Chris was talking about. Next slide, please. Some of the other players in this group were the Compass Community Health, Racial Justice, Diversity, and Inclusion Committee, which meets at Compass. Youth Thrive, which is a local BIPOC youth group at the Youth Wellness Center in Hamilton, and Spectrum, a Two-Spirit and LGBTQIA plus youth organization within the YWCA. Next slide, please. We also worked with various online organizations which provide free training to BIPOC providers working with BIPOC clients, and also members of the queer and trans BIPOC communities. Next slide, please. For all of this, we use basically a population health promotions model, which stresses the social determinants of health. Our focuses are on things like income and social status, social support networks, education, personal health practices, and support skills. We also have a strong focus on counteracting social isolation, which is a huge problem, particularly within the transgender community. And we wanted to strengthen community action, and our way of doing that was training the providers that we did hire so that we could improve capacity in their communities. And then finally, we wanted to create supportive environments and foster community building. Next slide, please. We attempted to provide health equity by addressing the lack of representation in queer services at Compass, hiring from communities that are targets of the program, and providing training opportunities to folks, as I mentioned earlier. Next slide, please. Some of the takeaways from my experience in here is it's obviously important to involve personnel from the communities you are serving, and that those personnel still need leadership from you in the way you would provide leadership to folks of your own community. So briefly, I found myself a bit hesitant to provide too much leadership because I did want our facilitators to have free reign in the way they thought they should develop the program. However, one of the problems that led to was that they didn't have enough guidance from me. So that was something that I learned that I shouldn't be too worried about providing that. Next slide, please. In terms of advice, which we're asked to provide, health promotion positions provide parameters within which providers are expected to develop their own roles. You're expected to find funding for programs you run generally, and grant writing skills are very important. And it's also very important to develop and maintain relationships with partner organizations in order to succeed in health promotions. I'm going to stop there because I think I am a bit over time. But if anybody has any questions, happy to answer later on. Thank you.
Thank you so much, Autumn. That was amazing. Next up, please help me welcome our final speaker, Selena, a project leader at OFIA Canada, leading multiple projects with a focus on health of children and youth. She currently leads the National Healthy School Certification Program and the Ontario Physical Activity Safety Standards in Education in OFIA. She obtained her Bachelor of Science in Geography and Environmental Sciences and her Master of Science at McMaster University, and is currently completing her Master of Public Health program part-time at Brock. Take it away.
Thank you. Can you see my screen? My slide deck?
Yes.
Awesome. Right. Thank you for the introduction. Thank you for this opportunity. And based on my introduction, I see some fellow Brock students. I am completing my MPH at Brock right now, so I'm always happy to connect to all MPH students and everyone here afterwards. So before I begin, I would like to take a moment to acknowledge the land upon which OFIA's work takes place on. OFIA's work takes place on traditional Indigenous territories all across Ontario, and we are grateful for the opportunity to meet and work on these territories and recognize the enduring presence of Indigenous peoples on this land. I'll skip the agenda. So I'll go a little bit about OFIA for those who might not know about OFIA, along with my role as a projects leader. I'll share a little bit about OFIA's equity-centered strategy for well-being, and I'll focus on the Healthy School Certification Program and then some lessons learned and advice for students. So for those that might not know about OPHEA, we are a not-for-profit organization, a provincial subject association for health and physical education, and a registered provincial charity. OPHEA's vision is to ensure all children and youth value and enjoy the lifelong benefits of healthy, active living. And through this, we provide the essential tools, resources, supports, and professional learning necessary to teach students the fundamentals of healthy and active living. All of our supports are developed in partnership with sector and subject matter leaders, and we are known as one of the best organizations for supporting the implementation of health and wellness initiatives across Ontario schools. So a little bit about me. I am a projects leader at OPHEA. I've been with OPHEA for about 3 years. Fun fact, I got accepted into my MPH at Brock and offered the position at OPHEA 2 days apart. So what interesting journey for me, but it's been a great experience so far at OPHEA. OPHEA is a projects-based organization, and I lead a portfolio of various projects within the programs division. So as mentioned, the Healthy School Certification Program, the safety standards, which is known as Ontario Physical Activity Safety Standards in Education. And these provide the minimum standards that educators and coaches must follow when planning and implementing curricular, inter-school, and intramural activities. Another project is the Inclusive Safety Review Project, developing a new tool, inclusive tool for educators to ensure all students are included within their implementation of planning activities. Building safe and healthy schools. So I'm working with a First Nation secondary school in Nipissing First Nation to develop an adapted healthy school certification guidebook. Those are my current projects, but I've had an opportunity to work on various other projects that OPHEA has to offer. To complete these projects, I follow organization project management practices. So my day-to-day looks like sort of looks like planning projects, making sure they're on time. As Chris had mentioned, online, everything's virtual. So today I'm at my grandparents' house in Westmeath, close to Ottawa, but usually I'm in Niagara. So I work on initiating projects, planning them, executing them, and monitoring the projects to ensure they stay on time and within scope, and as well as closing the projects and launching them, and always having opportunities to discuss with the teams for lessons learned. So this requires frequent meetings, as mentioned, all virtual with the project teams, as well as external consulting panels and committees to ensure the deliverables are on time and within scope. So as I had mentioned, OPHEA works in partnership with external stakeholders to ensure our resources and content provided is most up to date and relevant and current. Other than that, I also spend some of my time researching and evaluating research to ensure I too am staying current. So OPHEA aligns all projects and work that we do through our renewed equity-centered strategy. So our strategy aims to ensure every student in Ontario can thrive, as they all have a right to quality health and physical education where they feel like they belong. Our understanding of equity acknowledges the harm and inequities health and physical education has contributed to shaping and actively working to learn, disrupt, and reimagine ways to work in collaboration with folks who have lived experience at the margins. So as in the project, the health promotion project that I'm going to focus on is the Healthy School Certification, HSC. So HSC is based on a 4-step healthy schools process that helps schools to plan and implement a range of activities that promote well-being in the school community by focusing on health topics that are of importance to them. So these health topics include mental health, physical activity, healthy eating, injury prevention, growth and development, and substance use. And the Healthy School Certification is guided by 4 goals. So we want to ensure that we want to support schools to enhance the well-being of their staff and students. We also, through this program, want to encourage staff engagement and leadership opportunities, increasing adult engagement and prioritizing health and wellness, and overall to strengthen community engagement and partnerships. We are pleased to work in partnership with PHE Canada, as well as other provincial organizations, Ever Active Schools in Alberta, to make this program become a national program. So we are in year 2 of the national HSC program. So the Healthy School certification process or certification program is grounded in the essential conditions for comprehensive school health. And the four-step process is inspired by the Canadian Healthy School Standards and Canada's Comprehensive School Health. So following this process allows schools to take a planned and comprehensive approach to address the health topics as mentioned over the course of the school year. So these steps include assembling your team, step 1, assembling your team, step 2, identifying your school community priorities, assets, and health topics, step 3, developing your plan and taking action, and step 4, celebrating and reflecting. So the program, the 4 steps, is designed to support schools to implement the activities aligned with their health topics. So step 1, they'll work to form new teams or strengthen existing relationships and partnerships. And in step 2, the schools will be required to collect data at the start of the year to evaluate their school community priorities and assets, which will help them determine what health topics they should focus on and implement activities within step 3. And all activities planned are encouraged to align with at least one of the healthy school areas. And these healthy school areas include teaching and learning, the social and physical environment, policy, and partnerships and services. And lastly, step 4 is where a school will celebrate and reflect on their healthy school journey and evaluate what they've learned about their school. So this aligns with many of the health promotion competencies, such as policy and program planning, implementation and evaluation, partnerships, collaboration, advocacy, and assessment and analysis. At the end of each school year, OFIA also completes an assessment and analysis of the school reports submitted on the 4-step process, and schools are awarded a gold, silver, bronze certification at the end of the year. So OFIA is currently living into our strategy to evolve the Healthy School Certification Program, and we're currently undergoing a programmatic review. And the primary objectives of this review include evaluating the overall effectiveness of the program in supporting school communities and prioritizing student well-being, so prioritizing the evaluation of inclusion, diversity, equity, and accessibility, and identifying strengths and weaknesses that currently exist with the program, such as gaps and areas for improvement and areas for expansion, and also providing evidence-based recommendations for enhancement. So we're engaging with diverse interest holders to recognize these gaps and also be able to celebrate every school community as each school is on their own journey. So some valuable lessons learned, key takeaways I've gained through my experience at OFIA so far is working in a nonprofit. Partnerships and collaboration are so important. Nonprofits often operate with limited resources, so collaborating allows nonprofits to pool resources and leverage each other's strengths and achieve greater impact. So through the partnership with PHE Canada and Ever Active Schools with the Healthy School Certification National Program, that has been a great opportunity and experience working with them to learn from them as well. Another important lesson learned is cultural competence and diversity must always be considered. And when I say must, it should always be considered from the very start of a project. You need to be able to acknowledge and respect the diversity within communities and tailor your health promotion efforts to be culturally sensitive and responsive. So this is a really important piece that we're working on within the Healthy School Certification Program, because as mentioned, each school is on their own journey, and what might be a healthy school for one school is not necessarily the same for another. And lastly, always aim for long-term impact and outcomes that extend beyond the duration of a project timeline. So being a project-based organization, projects typically end, but always having an opportunity to talk about lessons learned and how the lessons learned can be applied to other projects, as well as opportunities to apply for further funding to expand and continue the project. So a lot of your time as well too is making sure you're meeting the targets and the outcomes that you propose to a funder who has provided the funding in your interim and final reports. And lastly, advice for students, and being that I'm currently a student right now, I remember attending one of these sessions years ago. I think networking and building relationships is super, super important. I was on the Ontario Healthy School Coalition And this is where I was introduced to Ophia. So I think through networking and learning more about other people's roles is really important, and don't hesitate to reach out to get to know how they got to where they are. From my experience, people are usually friendly and like to talk about themselves and their roles. So continue to network and build relationships. If you're interested in the nonprofit sector, I think the most important thing is to familiarize yourself with the unique characteristics and challenges in nonprofits, but also make sure you're looking at their mission and values and see if they align with yours, because in my experience, their nonprofits have been very fast-paced environment. So you want to ensure that the work that you're doing is meaningful to you as well. And also embrace continuous learning. That's sort of why I chose Ophia. Variety of projects, and health promotion's always dynamic and evolving. So always embrace learning and to stay current. I see, Gaia, you're on video, so it might be over time. So I am done.
No worries. That was fantastic advice. Very, very well done. Thank you to all three of our speakers for sharing their stories and their experiences. Now it's time to officially open the floor for some questions. We have around 15 minutes to go. One of the biggest questions that's always asked from students, and this is a heavy one, so all of you feel free to take this. It goes, I find that jobs in health promotion tend to have a variety of different titles based on the organization it is with. Do you have any suggestions on how to maximize our job search to find roles in health promotion? Are there any specific job banks or sites and strategies we can check and use, or key terms we should use in our search? It would be helpful to know how to get started, especially for new grads. Anyone is welcome to take on this question. Yes, Autumn. I thought I saw your hand up.
Sorry, I was muted. I started talking and still be muted. So I would say that certainly if you wanted to work at our clinic, community development worker would be what you would look for, because most of our titles have that in the title, or like health promotions. But I would also say that, like, I think a lot of these jobs actually do come from some of the networking that Selena was talking about. Certainly I got my job through networking and through doing like just being active in the community and doing like a lot of advocacy on a volunteer basis. So I mean, I think just naturally do what you want to do, and you're going to start to see some of those opportunities start appearing.
Mm-hmm. Lena, would you like to feel like you have an insight as a grad?
Yeah. So I think I have a bit of like unique experience. But it always did come through networking as well with my previous master's with the project. So I was going to the community and sitting on committees and building connections. So when an opportunity came up, I applied. So I was project coordinator, but it was in a way health promotion, promoting active transportation, which like healthy school planning, which is a portfolio in some public health units, but I'm not title health promoter. And then project leader out of FIA. I've always worked for nonprofits, so I tend to be looking at their websites and looking at opportunities when they come. So I'm frequently visiting websites.
Gotcha. Leah, I would like to bring you to our stage. Is there anything you would like to add from your experience of looking into jobs at health promotion?
Yeah, I think part of the thing that you need to do is figure out where you want to live. I think the first thing is the livability of your life, and then start to understand what are the potential organizations that would be doing health promotion in that area, whether it's community health centers or public health, government, as well as kind of looking at nonprofits. But I think you also need to think about what kind of environment do you want to work in, because some of those environments are more bureaucratic than others. So it's really about figuring out a number of things around like how you want to structure your life and what would bring you joy in your work. But there's also websites that are for organizations of that, like, so for example, Alpha, the Association of Local Public Health Organizations in Ontario, and there's one of those associations for CHCs. So starting to kind of look at where jobs might be posted, as well as networking.
Thank you. Looks like networking is a big factor that comes in. It is sometimes about knowing people. I do want to mention something that Andrea from our last presentation mentioned. Check out the actual description of jobs, because sometimes health promotion work is in the actual job responsibilities. So in our next question, it looks like a similar one was kind of answered in the Q&A, but in the Zoom, I mean, and people are wondering, how can we practice health promotion within the workplace? It could be a hospital environment, but as well as, workplaces that are not necessarily healthcare. What would be your suggestion on practicing that? Can give you a minute or two to think if you would like. I know. So Kitan, you provided a bit of an answer in the Q&A if you'd like to expand on that, or while our speakers have a moment of thought.
Yeah, I mean, social prescribing is a relatively new idea that's a little bit untested. Like if you look at the literature, how effective is it? There's not a lot of great evidence at this point, but it's new. So, you don't expect to necessarily have that evidence at this point, but it is just a way that, clinicians are recognizing that they keep seeing the same patients coming in for the same issues, and there are more upstream issues that need to be addressed to really help this patient. And so some more innovative practices are, exploring the connections that they have with community service agencies, and in some cases, patients don't know that they could be eligible for a certain package of money from the government, or they don't have the time or know how to complete the application forms. And I've heard about, collaborations with legal clinics to help patients apply for, to get on ODSP, or to access some sort of funding envelope that they have a right to. So just one idea, but I think that it's a really great question, and there's a lot of potential on how the downstream parts of our system can, play along more with the more midstream and upstream.
Thank you very much. Leah, do you look like you want to say something?
Yeah, I do. I don't know if the question is around like, how do you do workplace health promotion, encouraging employees to be healthier? And I'd say the slightly tricky thing that we know in public health is we can tell people to go do things, but that's rarely overly effective because there's usually environmental barriers. So unless you're able to really change the environment in which people are, it can be tricky to bring in things such as, like, for example, mental health promotion in the workplace. So if you're able to focus more on addressing, say, the psychological safety factors within the workplace, looking at some of the organizational factors, and also looking at some changes that you can make in the workplace. One that I really love at KFLNA Public Health is that we have an active transportation policy, and it sets out if your meetings are in certain distances, you can walk or you can bike, and then you can even claim and get $2 for it. But that's like maybe a little bit more work than it's worth to get the $2. I just love the opportunity to bike. It's a little harder to do that particular strategy post-COVID as there's less in-person meetings. But if there's the capacity to make changes at the structural level, that makes it easier for employees to do healthy things.
Thank you very much. That was very insightful. Autumn, I saw your hand up. If you'd like to add anything.
Yeah, I was just going to add a bit to the comments about social prescribing, and I think I've seen some really novel kind of approaches. So like at the community health clinic in North York, they have a program for Black folks where they can come in and get their hair done, which doesn't sound like a health clinic thing, but then while they're there, they'll take their blood pressure and check for diabetes, and so they can get other things done while they're there. They don't have to, but it's convenient because they're there to get the haircut anyway. And so that you can kind of get people to come into your facility, whether it's a clinic or a hospital or whatever, if they think that there's some kind of personal gain that they can get that might seem tangentially related, but actually is sort of importantly related. And I think the prescription program that we have is kind of similar in that way.
Yeah, it looks like you have given away all your answers. I will move on to the next question that we may end up on. In terms of your subscriptions, Autumn, that you mentioned, someone did have a question about the program. So feel free to kind of type it up in the chat about the food prescription program and kind of how was it developed and stuff like that. The question that came up in the chat just now is asking, what are some gaps in research you would like or you think it's important to have more information on in relation to social determinants of health or health equity? A bit of a hard one to finish off. Yes, Selena.
I think Indigenous youth, like more specifically, another project, well, through my co-op right now, working with Aboriginal Sports Circle and doing a needs assessment report and understanding their experiences within the First Nation school and as they transition into publicly funded schools, because like what is taught in publicly funded, specifically on land-based learning and what you define as being healthy is different. So I think focusing, like, there's lots of gaps in the social determinants and health equity with Indigenous youth across the country.
It was very, very well put, and that's something that I talked about in my NPH program at Western as well. So that's definitely a big one. Autumn, Leah, is there anything you'd like to add?
As I think about that, to me, it's there's not something I'd like to see as a gap in research, but a gap in practice. Like we're talking about the social determinants of health, but there's a lot less funding for that work. Governments are a lot less interested. So maybe there's a research of how do you convince governments to spend money on things that they're not going to see the benefit for and not going to convince voters to vote for them again. But for example, we know that investing in parenting and healthy childhood development is really, really important, but the funds to do that aren't there. So kind of trying to think of how do we tackle the determinants of health when there isn't the political will.
Mm-hmm. Politics always coming into the way. Well, oh yes.
Yeah, I just want to say something quickly to what Leo was saying. One of the problems too is that the way funding is often structured is funded in a way that actually, I think, dooms some organizations to fail. So there is some like political will to, for instance, fund community-based organizations that are led by community folks. So, LGBTQIA plus folks or BIPOC folks or, a few different other communities as well. The problem is that you can generally only get limited funding for maybe up to 3 years. And then you're in a situation where you can't get funding anymore, and then often the organization will have to join a larger organization. And then the next time the funding comes around for community-led organizations, you're not actually eligible to apply for it. So it really leads to a lot of failure of those organizations to remain independent and to continue to operate in the way that they initially wanted to.
Thank you very much, Autumn. Well, very realistic answers from our experts in the field. However, that gives us hope that in the future we will get more funding and health promotion will receive the attention that it deserves. And with that kind of triumphant hope for the future, I do want to note that we are close on our time, and there have been some questions that were submitted in the registration form and they've been answered throughout the presentations. But if you have any further questions, please email health promotion. So Thank you to our fantastic speakers for their stellar presentations and thoughtful panel discussions. Thank you to all of the participants for joining today and staying till the end. We hope you enjoyed the session, giving you a peek into the lives of health promoters, and you're seeking to learn more. Your feedback is highly valued, and we would love to hear from you in the post-session evaluation, which is going to be shared in the chat. Stay connected with Health Promotion Ontario on Facebook, LinkedIn, and Twitter, or X. And don't forget to register to get exclusive member benefits. If you have any questions, again, feel free to reach out to our team. Have a wonderful short week ahead, everyone, and a long weekend coming up. Thank you very much.
Take care.
Take care.